Okay, good afternoon, everybody. It's a pleasure to be here. I pretty obviously am a pediatrician. That's why I wear silly ties and Mickey Mouse hats. It's kind of a strange path that I took to get here. And I'll be kind of brief. I wanted to be a pediatrician starting at age 2.5 when I liked the fish tank in my pediatrician's office. That was my motivation. But I've come a long way since then. And I've actually been chairman of the Department of Pediatrics, and I started urgent care centers, and I've been involved in child abuse. I've been involved in research on the most common cause for admission in the United States, the hospital for children called RSV. During my career, I've seen thousands and thousands of patients, but perhaps something that's important here is I tried to kind of focus on what I thought were really important problems in pediatrics. And they tended to change sometimes. And you can just do your daily routine, see patients, which is awesome, save lives occasionally, which is fantastic. But I, on many occasions, felt like I wanted to do more for the community or for larger numbers of children. And for instance, there are many poor women and children in the country, and there's a program called WIC, Women, Infant, Children, which is a national project to supply them with food and things that they would need to just kind of be healthy, stay alive, have nutrition. And we had people who would have to come to the hospital, go to the WIC program, take 14 buses, spend hours and hours doing that. And I thought it would be great to have a WIC program at the hospital. Okay, so it was kind of like my entrepreneurial idea. Okay. And it took a lot of work, but we finally, after a couple of years, convinced the hospital administration that it was a good idea. We found a location for it, and we have been successful in growing a huge WIC program where women and their kids come, they get free food, and we did more than that. We started to teach them about nutrition, and we had a special class for breastfeeding to encourage women to breastfeed because that's the best way to go. We developed a farmer's market for the clients to come to, so they can buy like fresh organic food. And, whether or not you believe in that, it doesn't matter. But we wanted them to have a robust knowledge about what's best for their kids, nutritionally, exercise, etc. And I was successful in getting probably up to like $10 million in grant money for this from New York State. Okay, and this was kind of like just a sidebar, but it was something that I felt that was very important. At the present time, and I won't go into all the different things that I've done in that kind of area, but another really important was develop an urgent care center. You guys know there are urgent care centers all over the United States now, and because you have to wait 4.5 hours to be seen in an emergency room, which is not good, even if you have a sprained ankle. If you need an x-ray, it's even longer. So in 1992, actually, it's almost before they existed, I got involved in that, and we developed an urgent care center at the hospital, which is not the easiest thing to do, and patients come in, they get out, they get seen quickly, and they don't go to the ER and create havoc there. You have kids with runny nose, coughs, colds, they don't belong in an emergency room. And that was making some $3 to $4 million per year, okay? And has become a very successful entity, and now, I wasn't the first one, but many companies are doing urgent care all across the United States. One of them, my son is a partner in, they have 32 urgent care centers all around the city and tri-state area, okay? The most now gets you how I got to this stem cell project. It's a little bit, off the wall for a pediatrician to be involved in a very specific scientific approach with stem cells. I'm not a research scientist, but about 10 years ago, I became interested in pediatric disaster medicine related to 9/11 and all the effects, psychological effects on kids and the physical effects on kids. And basically, worldwide, there was no pediatric disaster planning. You'd have a disaster plan for the adults, and you'd figure kids are just small adults, so it's okay, but it's not okay. Kids are completely different in physiology, depending on their age, psychologically they're different. And I took a course in Israel on disaster preparedness, and now I give the courses on disaster preparedness, and I actually speak around the world about this, and I'm in charge of pediatric disaster preparedness for all of New York City. Okay, and we've changed how kids are triaged initially at the scene of an event. We retrain all of the EMTs and paramedics in New York City, and we have a special transport plan and secondary transport and surge capacity. We've increased the number of pediatric critical care beds in New York City by 200%, which is really amazing. So we're much more capable today than we were 6 years ago. And how did I do that? We and multiple partners formed a coalition of people who all work together on this. It was the Department of Health, the Office of Emergency Management, the New York City hospitals, expert in pediatric disaster medicine, surgeons, et cetera, et cetera. And we've now become a very sophisticated organization, and we speak nationally and internationally about this. And I've been in China, I've been all over the world about it, and I'm happy to say we're there. We're getting there. Kids are now included in the plans, pretty much worldwide. And we've been able to get grants from the U.S. government for this. We're up to about $2.5 million in sustained grants for about 7 years. Why am I telling you this? Because if you want to be an entrepreneur, you have to think out of the box. You have to decide on what you want to do, and hopefully it'll be something that will make money, but maybe even help the world. Would be nice. You can accomplish it, but you have to work hard, and you have to kind of be very focused on what you want to do. And then with the help of Bruce and all the other people here, I'm sure you'll learn the techniques and things that are necessary. So it's been a pleasure speaking to you.